Before we start.
All right. Welcome back, everybody. Thanks for the reset. That was perfect. I think I'm turning it over to Bob Transky to introduce our next set of partners and topics.
And speaking of introducing our partners, something I forget to do sometimes, so let's start with that. I will start at the head of the table.
Nick Casarona, Vice President and Mayor.
Jason Hess, Executive Director of Heartland Radar.
Lori Alvarado, CEO DECA.
Kirsten Watkins, CEO Bert Nash.
Julie Brandstrom, CEO of Heartland Community Health Center.
Jonathan Smith, Executive Director at Lawrence Douglas County Public Health.
Dan Watkins, Headquarters.
And Bob Transky, Director of Behavioral Health Projects for Douglas County. This tends to be a full budget hearing, and in the past, it started with me spending 10 to 15 minutes walking commissioners through the synthesis of individual budget requests. I want to really try to minimize that as we tee this up. One of the things that is different this year is in the past, there's been sort of a separate behavioral health projects spreadsheet, and those requests have been linked to themes. So I want to just point out some things to note in the individual budget requests that you've received from partners, and then 3 requests that have come from administration this year, which is new, that hasn't happened before. So as commissioners have reviewed the individual agencies' budgets, our partners, some of those partners do collaborative work on collaborative projects. At other times, they offer a service that serves the system, but they're uniquely or individually responsible for that service or for that project. This year, Bert Nash is always the largest budget in our series of requests, and I want to point out one piece of things that are different in the Bert Nash budget request. As you know, Bert Nash has submitted, after a series of financial reviews with the TRC, and significant dialogue with the county, revised program-specific budgets for each of the programs that are funded. What I'd like to share is as a result of those reviews, there are 2 programs that historically have been funded by Douglas County, the RAP program and Transitions, that after review and revision by Bert Nash show that those 2 programs are now self-sustaining. And so as you review the Bert Nash budget request, the dollars and the allocation that were allocated to RAP and to Transitions, $860,000 for RAP, $645,000 for Transitions, those 2 allocations have been transferred over into the crisis services space for Bert Nash, so that we can begin to more carefully monitor what the cost for uncompensated care in the crisis services space looks like. So that is a difference you will see with the Bert Nash request. Other than that, I believe, although we might discover that I am wrong right here, but I don't believe we are, the requests that you've received from our partners are all static, with the exception of the supplemental requests. In some cases, the allocation is the same, but the distribution between one partner or another might be a little bit different, and also might adjust as the rest of 2026 moves forward. But I wanted to highlight 3 supplemental requests that you've heard from administration. The first one is $200,000 to support the ongoing work of trying to find a solution for justice-involved housing. There was $200,000 in the budget last year. A project emerged in the middle of the year. That project did not come to conclusion by the end of the year. So that supplemental request is kind of requesting to continue to hold space at that allocation level so that we can continue to work on trying to find a solution to getting behavioral health court clients into a more appropriate housing environment. Those clients are currently housed at Transitions and also at Bridges, and that is more expensive and potentially a not appropriate fit in terms of a clinical environment for those individuals. The second piece is, as part of our last study session, we talked about exploring expanding the capacity of the current tool that we have with MyRC and using Gelada potentially, which is a software product that does closed loop referrals. And we talked about that. There's a $100,000 supplemental, basically a placeholder in the budget so that we could continue to do that work if in fact our partners continue to feel like collaborating on that would be a good project. And then the last piece is there is a $140,000 capital request, one-time capital request to support securing and renovating an appropriate space for Anchor Point and Alive Inc. to have a co-located headquarters building facility in the community. Those are the three supplemental requests that came from administration. In addition to that, there are two supplemental requests from DECA. One to continue to support the school-based prevention program. The second is a new program, which would be youth treatment, school-based treatment for SUD in schools. And the third supplemental request from DECA is a request to provide a full year of rent and utility assistance for the new 10-unit transitional housing project. Last year, that amount was $104,600. Staff and DECA have collaborated to come up with the right number for a 12-month. And so there's a $46,500 or $45,600 supplemental request there. The last supplemental request comes from Heartland to add a community health worker. This is a similar request to what they came with during the municipalities fights addiction process. And we've clarified with Heartland that the request is to go from 9 existing positions to 10. Currently, 7 of the 9 that Heartland is staffing are filled. And all of our partners can speak to their supplemental requests, but I wanted to give you a 30,000-foot change with how the Burt Nash budget is put together and the work that we want to do moving forward, and then just give you a couple of details so that as you're making reference to or you have specific questions about the supplementals, we can get located on the map correctly.
Thanks, Bob. Appreciate the quick overview. Commissioners, I might suggest that we start with questions about those. We start with the 3 supplemental requests that Bob gave us an overview that that are coming from administration, especially since that's as highlighted, a new way of making a request for some of these funds instead of direct from partners. So any questions for Bob on those? Maybe not. Okay. Well, in that case, it's open season for questions for our community partners. If anybody has one they want to kick us off with.
Well, I'll start with the headquarters, if that's all right, and just a couple of quick questions. The KDADS funding that comes to headquarters, is that a lump sum or is it tied to call volume?
It's allocated in a lump sum, but it is a reimbursable grant based on actual expenditures with monthly requests submitted against the total amount.
Okay. And then there's an other revenue line, but in your narrative, it talks about, I assume there's a fee for service. There's some call answering for Burt Nash and the TRC. Is that where that fee for service would be captured, is in that other revenue?
Well, yeah, that's currently $4,000 a month.
Okay. I
Good.
didn't look to see whether, are there other things that fall into that category? Is that the main other revenue? Yes.
It's one of them. We get a $60,000 a year donation towards our rent from an anonymous donor.
And any progress towards a board?
I plan to serve if the court will approve that. Walter Way, who previously worked with us, has agreed to be on the board. We've got some others who we've talked with and have expressed some interest. We have a new operations director who started today. We plan to announce an executive director soon, and then hopefully I can step back and we can have a beginning board. Our bylaws call for a minimum of 5. So, pardon? Okay. We also, I mean, last year we didn't, I'm trying to remember, we didn't have audits. So we've now done 22, 23, 24, 25. It started off with a adverse finding, went to qualified findings, now clean audits. We're now switching to the state fiscal year. So we're going to do a short year audit in 26 from January through June. We have a new financial operations manual. So we feel like our financial operations are in order. We still have a payable to KDADs that we're talking with them about.
That's all the questions I had for headquarters.
So Dan, I'm looking at your budget here, and when I look at contributions, I see in 2023 you had 288, and then 2024 185, 25 121, and now for 2027 we're down to 100,000. So that's a difference of 180,000. And it just jumped out to me that your request is for 180,000. Can you give me some understanding of why we've seen such a reduction in contributions over time that might help us understand what's happening there?
Contributions from,
Well, I'm assuming that's like, there's also fundraisers, and you had in 23, you had 5,000 in fundraisers. In 24, you had 10,000 in fundraisers, and then it's been 0 since then. So I'm just interested in why private contributions are dropping so rapidly. And
because we haven't sought them as we've tried to sort through our financials. We didn't feel like we could go out and ask people for money if we couldn't show them audits that said we're financially have our house in order. We're in a position now to start doing that. But
Okay.
We still receive some,
okay,
but they're not a lot.
okay, thanks.
Any other questions for headquarters? Okay. Commissioner Dorsey?
I got one. The supplemental request you have, is that for calendar year 27 or state budget year 27?
Calendar year.
Questions for other partners? Commissioners?
Okay. Awesome questions for, let's see, let's do DECA. Good. There's a discrepancy between the county request on the narrative and on the budget spreadsheet. So is it supposed to be the 960 or the 873?
On the spreadsheet, sorry. Is that what you're asking?
So it's the 873 from the spreadsheet that's the request.
Commissioner, can you clarify what you're looking at so I can help?
I think it's 873, but you can double check me.
Okay.
Yeah, on the.
I'm trying to clarify as well.
Right. There's the narrative, which has 960, 772 as the 2027 request, but the spreadsheet has a lower number, 873. And we can.
Yeah, I see what you're talking about.
We can sort that as needed. I can ask more questions if that's.
I'll have Jake pull up their service agreement and see what, Jake, if you could pull that up, see what you could find for DECA, that'd be great.
We'll check. What I believe it is there was a reduction or leveling of the SUD treatment services between Mirror and DECA for this year. And so I think when the budget request came in, it mirrored the previous year, and we sorted that through. So obviously we didn't get it right in all 3 cells, but I will double check on that and double check with Jake as well. I think that's what it is.
And then peers that, you know, we talked about some with DECA, those are actually not funded through DECA itself. It's funded through a different line. Is that correct? It'd probably be a Bob question.
Commissioner, I'm sorry, I didn't hear the question.
Sorry. The question was, where are peers funded? We talked about the peers that were doing the social detox work at DECA, but I don't think they're supposed to be captured in DECA's budget. They are.
No, they are supposed to be captured in DECA's budget because the peers for that are for the social detox project and the peers that staff that project. The rest of the peers, except for the peers, some of the peers with Heartland Radac are funded through the Peer Fellows project and that overall allocation for stipends for those peers, which varies based on whether they're part-time peers or full-time peers and whether the agency has any supervision costs involved in that as well. So those are not consistent agency to agency.
Okay.
And the other reason that that will change is because after the first year or during the first year, sometimes a partner finds a match or an additional partner. And so that fluctuates as we move through the year. But the peers, DECA's peers are on the personnel line for the social detox project.
Got it. Thank you.
I would point out, Commissioner, too, if you look at the summaries on the behavioral health project's budget spreadsheet, so that was towards the beginning,
Okay.
we really tried to line out and color code which partner got what of the different pools. So, yeah, it's on that kind of page 2 in the back here, and it's
Okay.
color
The
coded by partner.
DECA detox pool.
Yeah, and from what Jake looked it up, the 960 is the right amount. It just was not, their spreadsheet was not updated.
Okay. And you know, these are written in March, and then we've had the municipalities fight addiction conversation. So it's a little bit of mental exercise, at least, to figure out what's been covered. So I wondered if that was the piece that was different, but I think it isn't, and that's okay too. The block grant, there's a federal block grant, and I don't have that captured for the amounts in the spreadsheet. But that's a significant source of funding.
It is. It's our primary source. And the reason why you don't is that fluctuates every single year. So we didn't have, when we had the 2026 allocation when we went through budget hearings, and we just received last week our 2027 allocation, and that has not been captured because we had no idea what we were getting. But yes, it is primary source of our funding.
This was, I think Bob actually covered this, and I just want to double check. The supplemental 2, the second supplemental request for DECA for the 45,000. As rental assistance, is that for the new duplexes, not transitioning out of the new duplexes, but it's that?
That is for the new duplexes. That is, represents the addition for a full year. What we had in the current funding is 6 months.
Okay.
And so that would be what we've kind of settled on for a full year of funding in addition.
Are there other operational supports for that program, or that?
We have some state funding. And then, of course, depending on the eligibility of the client, there could also be some Medicaid funding that helps with housing and services.
Thanks.
Can you talk more about the social detox project? Is this at all related to the most recent work session that we just had?
That is all related to the most recent work session we had. Yes.
Commissioner, is there a
so-
specific question on?
So I want to know if the social detox funding that we're talking about here that's in the budget, if it's related to the most recent work session that we had.
Yeah, it's related in the sense that there are 3 buckets for funding. SUD treatment, which is primarily for residential treatment to offset the cost of that. Mirror has a share of that, and DECA has a share of that. In this case, they're both the same, $200,000. And then there was a social detox bucket. And when we originally started working with DECA, DECA got that exclusively because DECA was running the project. Last year, because we have a deficit of, there are no social detox beds for men in Douglas County, and we brought Mirror in as a partner to work with Cardinal Housing and some other pieces of the overall equation. Mirror shared in that breakdown between those 2 pieces. Ongoing, if given the fact that The TRC is now online. We continue to not have detox beds readily accessible for men. And the disparity continues in terms of the number of men versus women who are served. We're trying to find a collaborative solution to get people to social detox services by working with partners. One of the proposed partners is Avalon. It's clear that commissioners have different perspectives and opinions about whether Avalon would make a good new partner in this work. Those conversations will continue as encouraged by Commissioner Dorsey with partners, and we will come back to you with more clarity about what the partners agree or consensus around trying to address that gap. Last year, DECA served, I believe it was 76 individuals. I believe that only 6 of those were men. So a project that was designed to close a gap to provide social detox services in Douglas County or for Douglas County men, that's not a gap that's been closed, and that's the gap that we're trying to address by looking at other partnerships, by looking at other ways of running that program.
So to move forward with certain initiatives or to drive initiatives with this commission, you need a majority. You did not get a majority during that work session.
We did not take any votes, nor was there any action requested coming into that work session. It really was to get feedback from the commission about whether or not Avalon would be an appropriate partner, and there was plenty of thoughts about that. And the second piece was, given that, if there's consensus among the partners about how to move forward, we would bring that back to the commission as we have with everything we've done with those SUD buckets. Since we started having those 3 buckets of funding, we have adjusted the dollars that go to one partner or another. Last year, several times during the year, I think we made 2 adjustments. We bring that back to the commission, and the commission is asked to act on that.
And I did not hear that there was consensus after that work session to continue to move forward with conversations with Avalon.
Yeah, we haven't done that yet.
Bob just said that yes, per Commissioner Dorsey's direction, that those conversations are going to continue. Commissioner Dorsey, did you suggest that Bob should move forward and convene these conversations?
I'm going to say, I think Bob spoke a little bit ahead of it. We have work to do on where we're at on SUD before we move forward. But what you have in front of you, commissioners, are buckets for funding, and then we'll bring back a structure for you.
And I want to make sure that in these buckets of funding that we do not have a line item that we're not overly seeing, that there's not transparency, and that we're not funding Avalon or a community partner, or there's not a line item in here where we might be funding a for-profit entity.
Commissioner,
Commissioner
we'll
Anderson,
bring that back. If we're going to add a new partner, we'll bring it back to you for action. On this sheet, on the behavioral health spreadsheet, you have the total dollar amounts for each of those pools. So that's a part of your budget document.
I just want to refocus and make sure that any question you might have had specific to DECA's dollar amounts. I mean, we don't have a supplemental request in front of us related to social detox. But I hear you're trying to pinpoint, if I want to make sure I'm tracking right, that you are talking about this comprehensive behavioral health projects budget that we have and the 3 lines in the buckets we've been talking about with social detox. You're just seeking clarity that right now those are the status quo, that DECA and the current partners that have already been funded historically, that this commission has approved, is what is reflected here, and that there are no new partners. Is that your question that you're just seeking to clarify?
Correct.
Okay.
And that the conversation that we had in the work session, that we are not, because there was no direction given, and that staff is not going forth and creating a project without the Board of County Commission approval to do such.
No, we'll bring it back to the commission after consultation with partners, if the recommendation, we'll bring it back to you.
After consultation with partners and after that work session, at least this commissioner did not perceive from partners that they were in alignment to move forward with that work.
Yeah, so we'll bring it back to you. once we do more work.
Commissioner Anderson, I want to make sure I hear you, and I also want to refocus us on the budget conversations for today. I think that what I heard was that there were more conversations to be had clarifying social detox possibilities into the future and new possibilities. There was further conversations to be had amongst partners. Depending on how those conversations go, I think will determine whether we will hear more about the potential proposal. I don't believe that there was any decisive consensus one way or the other than more information was needed and more discussion in the future. But as it relates to today, I don't think that those are, I don't see those reflected in any of the supplemental requests we have. While we're talking about DECA, since we do have 4 different requests from them, we've talked about a few of them, but I just want to check in with commissioners. Are there any specific questions about, we have 1 ongoing and then 3 one-time requests. We've talked a little bit about the ongoing request for the supportive housing dollars for the new housing that's available. And I don't think we've talked about any of the others. So commissioners?
I have a question on supplemental number 3, but I see,
Well, I was just going to say I didn't give direction to anybody. Thanks.
so on the supplemental 3, I think you've had a grant for, I'm sorry, this is for the, what do I want to call it? The school-based program that was in Perry Lecompton and Eudora. So you've had grants for 2 years, and then at the Municipalities Fight Addiction conversation, I think we added another 6 months to that. And so that's also in the supplemental. What's your time frame for when you feel like there can be kind of known outcomes and some kind of feedback from the data from that project?
From the county funding or the funding that we've had?
From the project overall, because you had 2 years of funding from a grant
Yes.
specifically for that, and then 6 months from us.
Yes, so we got a request from Bob last week for the data for the project that we've been doing under different funding, and that report is coming his way this week with our data. Is that what you're asking, the data from the outcome from the
Yeah,
prior?
I was just
funding?
looking for a timeline on that. It sounds
Yep.
like it's like very soon.
Yep,
So, okay.
absolutely.
Thank you. Appreciate it.
I want to follow up with the adolescent treatment and the prevention program. So there's nothing listed in your budget spreadsheet under grants or contributions. So I'm making the assumption that school districts aren't putting in any money to those programs at all. Is that true?
That is correct. We're starting a program. That's what the request is for. And yes, you might guess there are school districts in the county who need, right, assessments, different things, and some of the students' families are eligible for funding and some are not. And so this was submitted as a response to requests for services. And at this time, it's a new effort, and there is no other funding unless a family would be Medicaid eligible, that sort of thing, the normal kind of funding.
Right. And so like I'm familiar with Title IV Part A funds that are specifically given to school districts for prevention activities. You haven't had any discussion about districts using, I mean, it wouldn't pay for all of this, but it could certainly be part of the balance of that. You haven't had any discussions with them on.
We've had multiple discussions with school districts, but not about using that funding for this particular need.
And would you see school nursing services being involved at all in the adolescent treatment? I mean, there's federal funding and state funding for school nursing. Is that in there at all? Has that been part of the
We've
discussion?
not had any conversations
Okay.
with school districts about nursing funding either.
Okay, thanks.
Hold on that just a little bit. It also sounds like it has some overlap with the RAP program in schools, and I didn't know if there were conversations about any kind of working together on that, or if they need to be separate.
We work closely with RAP workers when they're in the school district, either for prevention or other referrals. This is to really concentrate on SUD specific. And so yes, we do that when they come to us for treatment or assessment. Lots of times there is very little funding available for adolescents unless they are Medicaid eligible. But outside of that, even block grant is limited and other funding sources are not as available.
Lori, I was curious about the one-time request for naloxone. You mentioned in the narrative that one of the grants that DECA receives from the state is ending September 30th of this year, and it's not renewable, which is $500,000 less. Can you just color that in for us a little bit? What was that grant? Why is it not renewable? And what other avenues are you trying to backfill?
It's a federal grant.
Got it.
And
I thought that might be the case.
it's federal grant and right, it is what it
Copy
is. The
flag.
funding's ended.
Okay. I wasn't sure if they were pass-through dollars or if it was something state specific since the narrative mentioned state. Okay. Other avenues you're currently exploring or have had success with to try and make up for that? How big of an impact do you expect that law? I mean, was that funding all going to naloxone purchasing?
It was
or
all
just
going for
broader?
naloxone.
It was all going for
Yes,
purchasing. Okay.
not specifically to Douglas County, but Douglas County has a lot of requests for naloxone. They're one of our highest requesters. And because of state money, we have state money, but it has to be distributed across the state. And so we can't give higher representation to Douglas County than their population would indicate based on state how we figure, right, population and distribution. So Douglas County will lose some naloxone distribution. So you ask about other funding. We have a relationship with the Attorney General's office who gets some of the money for naloxone or through the settlement for naloxone. So we have conversations with them regularly. We've also submitted to Kansas Fights Addiction for some money. None of those have come through. So, right, you try to figure out how to fill that gap.
Okay, thanks. That's helpful context. And then the final question about that is just how is it possible to paint a picture? Or has your team kind of figured out without being able to fill in that funding loss? And I'm talking more broadly beyond Douglas County at this point, because I know it's a big picture for you all. What's the contingency plan for distribution? I mean, do you have an anticipation of at what point it might be a real stress point where you're unable to distribute and meet those requests? I know that's a little hard to pinpoint. I'm just trying to understand
Hard to
like
determine based
how
on requests. Yeah.
drastic does it?
It's hard to determine based on requests. What has helped us is a new law took effect July 1 that allows the administration of naloxone past its expiration date up to 10 years of expiration. So we have been doing a lot of education about please don't throw out the naloxone that you have. You can still use it up to 10 years. We've been doing a ton of education about that. So that is one of our remedies is we hope that people will not throw naloxone away just because it has an expiration date of 2026. They can use it for 10 years after that. That's one of our big pushes right now. We've not been able, I mean, it depends on whether funding comes through from some other avenues, what our stress point will be. But I would suggest to you that in the next 6 to 12 months, there's going to be a significant stress point with having enough product to be able to continue to distribute.
That's helpful. Thanks. And way to catch my softball. I was going to bring up that July 1st law change. So thank you for the public education. Any other questions for DECA commissioners? Okay. Other partners?
This question is for Julie. Community health worker, can you talk a little bit about the impact that you hope that, if funded, the impact that you hope that it would make in the community?
Sure. So we have seen better engagement with patients that are engaged with a community health worker and also engaged in SUD services at the health center. So we know that they make a tangible difference to outcomes for patients. They help connect them to other services in the community, walk alongside them. And so we know we've seen outcomes already because we have one community health worker at the health center that is working with SUD patients. So, and that person is limited in their caseload. So we would like to add another community health worker so that we have additional support for patients that are engaging in SUD treatment.
And you note that in your budget request, the majority of the individuals that you're serving are uninsured.
Correct.
So you're not able to bill.
Often we are not able to bill.
Okay. And, but it does look like you are seeking to redetermine those individuals and get them on some sort of health plan, depending on their need.
Yeah, that is part of what community health workers can help do is work with patients to explore opportunities for coverage. We have a couple, 2 to 3 that are dedicated to insurance, enrollment and navigation and working with patients to find coverage options.
And how long does that process usually take a community health worker to support an individual?
Oh, gosh, that's a great question. I don't have an exact answer. I could certainly get one, but I think it's a fairly lengthy process.
Okay, thank you.
Well, I have questions for Bert Nash, but we're not there yet.
Gotcha. Sorry. Thank you. Julie, can you expand a little bit on so we got clarity that you have 9 community health workers currently. And we've talked a little bit in recent weeks or months here in these chambers about different ways of funding them. Just talked about how uninsured folks are, you don't have a payer source for those people. Can you just color in a little bit more for us how those other positions are being funded? And then do you have them, I guess, operationally deployed in different ways and you're seeking to fill in a specific area of operations?
Sure. So we have some community health workers that were funded under federal grants. One was an early childhood development grant. The other was a behavioral health service expansion grant. Those were federal grants that once the project period was over, rolled into Heartland's base grant. So now that is part of our annual base grant. So we were able to sustain those community health worker positions long-term. And then we also just get creative about how we are able to fund community health workers. We have our 340B pharmacy program, and which is a concern because 340B is at risk. We are seeing more and more pharmaceutical companies that are putting restrictions in place on contract pharmacies, and that's eating into margin. But we often use the 340B savings to reinvest in other programs at the health center that we can't bill for. And so 340B is a source of revenue that we have been able to invest in enabling services such as community health workers. We do have specific areas that each community health worker is focused on. As I previously said, we have one that is working with SUD patients. We'd like to add a second. We have community health workers that their specific expertise is insurance and enrollment navigation. We have one that is located in our food pantry and helps patients navigate other services in the community, but she specifically works with folks that are engaging in utilization of the food pantry. So we do have kind of specific focus areas for each of our community health workers.
And is this additional one that you're seeking from the county? Is that the only one you're actively pursuing? Or are you trying to grow the number of community health workers by more than one?
Right now, this is the only one that we are seeking, but we also do have a request out to Kansas Fights Addiction. They had a specific community health worker application that was open, and we did apply for that as well. So
For this same position?
For this
Okay,
same
that was going to be my
position.
follow-up
Yeah.
question was, had you asked for this position anywhere else?
Yeah.
So asking for one and you've asked for it in 2 different places, correct?
Yes.
And what's the timeline of knowing about that?
We're not sure when the decisions will be made for the Kansas Fights Addiction grant, but I mentioned this to Bob a few weeks ago when I talked to him about it, that if we were successful in getting funding from Kansas Fights Addiction, we would be happy to return funds back to the county.
Thank you. Any
I
other
believe the
questions?
published timeline on that is November.
Bob? Any other questions for Heartland? Okay, Commissioner Dorsey, you can cue it up for Bert Nash.
Specifically on the TRC, your budget request for 27 is in round numbers, $1.6 million. I think that's written into the current contract that expires at the end of this year, and I presume would be renegotiated Is anybody working on that yet?
Yes, the operating contract for the Treatment and Recovery Center, that expires in October, this coming October. So that will be probably the next thing on our agenda to be talking about. We have not had conversations at this point yet about that contract. But it's coming.
Well, so your budget request is presuming that things go as is?
Yes, this is the hard part about all of the different deadlines. I mean, even in the original submission, because of the timeline, we included a supplemental request because we hadn't yet known about the 2026 supplemental, and now we do, and withdrew that supplemental request for TRC. So yes, this is just part of the stepping stones of these complex processes, that this came first. And then that will come in October.
Context for that also. So again, at the beginning, we talked about dollars that we were sweeping from RAP and from transitions, all put on a line of $1.4 million for crisis services for uncompensated care individuals. That's where the anticipation is we would address this between the MRT program and TRC in terms of how those dollars could be reimbursed. So that is at this point how we're anticipating looking at this financially.
The other question I have for somebody is the negative cash balances that you're presuming you're going to have.
For TRC specifically?
Yeah.
Yes, I mean, that's part of the challenge of the budgeting, is understanding the differences in our budgeting processes, so revenue versus cash basis. And many of the things that we're identifying as revenue are not cash on hand. So it's just part of the complex process of us understanding and planning for the budget. But yes, that is part of the challenge, is understanding specifically our crisis services across all of Burt Nash are much more expensive and receive much fewer fee-for-service revenue than was ever anticipated in the origination of these ideas.
Thanks.
I have a question about uninsured care. I was trying to, I hear that there's a need for more, and that's where that budget dollars. But in your request, it says the percentage of uninsured individuals served decreased from 23 and 24 to 18 and 25. And you credit the good job that you all did of pursuing Medicaid claims. So it sounds like the numbers are going down, but you're wanting funding to go up. Help me understand that.
Yes, great question. There's some complex answers to that. One is that, yes, we have put a lot of energy and effort in towards and advocacy towards asking people about their insurance. We've contracted with an external firm to help us outreach clients in order to connect them with services or apply for Medicaid and get them connected. So that has not happened by happenstance, that number has gone down. That is a result of direct efforts on our part. But on the other hand, what we're seeing is with our crisis services in particular, those numbers of folks who are uninsured that are utilizing those services has not changed. That in fact is going up and is demonstrating, I think, some interesting factors for us about the people who are utilizing those services and who need them the most, who are unable to pay for those services.
So are you saying the acuity of those who are uninsured is very high?
Yes.
Even though the numbers of the total numbers who are needing that type of support is going lower?
Yes, well said.
Thanks.
I'll have some questions on, we're talking about revenue there. So how's the billing progressing? Are we expecting to see, because I know that was one of the things you inherited was some difficulties in billing. Are we getting up to speed with that? And does that then reflect in the revenues projected for 27?
Yes, there have been many improvements on that. Clearly, there was a need to make improvements in those processes. That has included hiring appropriate staff and really expert staff like Danny, who's in the audience here as our CFO. And a number of other folks who bring their expertise. Also, our contracted external parties with SSE and Hasse and Long have really helped us improve those processes, along with the TRC consultants who gave us a lot of very specific feedback about how we could improve those processes. We are anticipating some improvements. However, it's a tedious process. There are times where it feels like 2 steps forward and 1 step back. There is a challenge, not just with us, but across the state with a payer right now who is rejecting claims, and we're seeing some challenges there and being proactive. But yes, we're anticipating some benefits of that labor.
And kind of recognizing that, I'm not sure what the industry standard is, but like the percentage of likely revenue that can be brought in from claims, because I know that that percentage is not 100. And is there an industry standard about, what percentage of total claims are likely to be drawn down?
That's a great question. I don't know the answer to that industry standard, but I do know that we track what's called clean claims. And the number of clean claims has gone up for us. It is not 100%, but it has gone up in the last year substantially. And we are continuing to monitor that to make sure that everything on our end is going out as cleanly as possible in order to be received and processed by insurance providers.
And so I'm just looking at the revenue numbers provided for Medicaid and non-Medicaid, and so private payer, et cetera. And they're flat from 2026 to 2027 proposed. And I know there's a lot of variables that go into that, but do you foresee like at like a 27 readjustment, like kind of realizing some additional revenue through those sources?
I don't know the answer to that right now. I mean, I think in the last year, we have taken appropriately a more conservative approach to those estimates and forecasting. There, I think, was a history of overestimating those incomes, and that was challenging for us. So I think that was part of the intention of keeping those numbers flat, is certainly if those reimbursements are higher, that's wonderful for all of us. But we are being very conservative and thoughtful about what we are expecting and trying to be as proactive as possible to ensure that we're okay no matter what.
I got another question about your clientele at the TRC. Is the majority of the folks you're seeing just a true psychiatric crisis or co-occurring disorders?
Both, most certainly. I mean, I think that's one of the special things about the Treatment and Recovery Center is that it's a do not reject facility, meaning that anyone can access those services. That's different than other crisis stabilization units throughout the state. We are the only one that is do not reject and is welcoming to anyone who needs our services. So I would say the trend is the complexity and the acuity of those clients. Most of the people who we're serving have both and or multiple diagnoses that are contributing to their psychiatric needs. So, yeah.
I have some questions about the Youth Recovery Center
Yes, please.
supplemental request. So first, staff has recommended that it would be contingent upon raising a portion privately. Do you want to respond to staff's recommendation?
That was also our recommendation. We talked about this beforehand and thought that that was appropriate and respectful given the circumstances to ensure that we completed 90% of the project. And then this would be a capital investment in that final 10%. And we already have raised, I believe, $6.6 million towards that process. And I believe 47% of that was with private donations. So we are making great strides. I think part of the reasoning for us submitting the supplemental requests was to ensure that these critical resources for youth in our community happen as soon as possible. We need these now. We needed them yesterday. We would love to open this as soon as possible. And again, this would require us to do 90% and to demonstrate that we have raised those funds and are that close to the project to be able to complete.
Thanks. Talk about your projection for ongoing costs for that building. I mean, I think there's a youth recovery center in Topeka or in Shawnee County. Am I correct on that? I
This
could
would
be
be the
wrong.
first JCIC. The
Okay.
TRC is also a CIC for adults. So this would be the first JCIC, but
Okay.
similar to the TRC, there are other types of licensure in the state that are similar. So I don't know specifically what the licensure is for that one that you're mentioning, but this would be the first JCIC in the state.
Okay. And back to, I should have started with the first one,
Yeah.
which was talk about ongoing costs for that. Are we providing these services just not in a place that is dedicated to youth now? And so we wouldn't see an increase in costs for sure, because I would expect maybe I'm wrong. I'd love to be wrong, that you may come back to the county again once the building is open and say, we're going to need to now fund the ongoing cost of providing these services, but maybe I'm wrong.
Well, at this point, this is a one-time request for capital investment only. We do have the luxury at this point of 3 years under our belt with Treatment and Recovery Center. And as you all know, the ups and downs of figuring out how to fund that model. It is much different with kids. The portion of kids who are covered with Medicaid is exponentially higher than adults. So the funding model is sound for a youth recovery center for us to operate that independently. Also, to your point about the other services, so this is one building where we would be offering all of our comprehensive services for youth. The majority of those services we already have and are located at 200 Main, like our outpatient therapy services, our medication services, our case management services. So the bulk of that building would be the established services that we have already, with some opportunities for us to expand those services. It would be that top level, which is something we don't have already and we don't have in this community, which would be the crisis center.
Where do kids go now?
Now they travel outside of our community to get that care. So they're going to Topeka or Kansas City. We see youth every day in the urgent care portion of the Treatment and Recovery Center. We can't admit youth, obviously, to that facility since it was designed for adults, but every day kids are going to that facility and needing a higher level of care. And typically what we're doing is screening them and trying to get them into a hospital in Kansas City or Topeka, and or taking them to LMH to wait for one of those beds. So again, we need these critical resources for our youth immediately.
So with a YRC coming online, does that then free up other space that Bert Nash currently is doing those services elsewhere? And would that translate ever into like giving up some rented space and saving some money there?
Yes, so we're already doing that. We have been renting space at 346 Main, and we have some space in the building next to the YRC. So in October, we're doing a grand shuffle of some of our staff. We are bursting at the seams at the current moment. We have staff sharing offices. We don't have enough space for the services that we're providing. So we have a plan of moving some of our staff away from, again, the 346 Main where we've been paying rent, and that will end in October.
And the costs for that, rent in one place versus rent in the other, are they comparable, or are you expecting a change?
Not significantly comparable. We have some opportunities for some more space again in 3500, which is next to the YRC, and looking for some tenants in those spaces as well. So we're working all the angles to try to make sure that it's as financially feasible as possible. Mm-hmm.
I got a question about the YRC building. Are you doing work on it currently, or are you just waiting till you get all 12 million or whatever?
No. It's happening. It's in the works. Actually, just at the end of June, there was some money from KDADS that we had to spend by the end of June. So the outside Sally Port is being worked on right now. We are working with our teams, our architecture and construction firms, to lay out a process of that construction. But yes, it is already in the works. And again, we're anticipating, part of this proposal was to anticipate this last phase of the construction to get us across the finish line. But yes, many funds have been raised. Over half of those funds have been raised already, and construction has started.
What's the timeline for completion? I mean, is it based on the fundraising?
Yes.
Looking at 27, 28, 29? What's the thought?
It's a great question. I mean, I think our eye has been on 2027 for a long time. I think, again, there are many factors that contribute when it comes to fundraising and the complexity of construction. But as soon as possible is really what we're looking for.
I think your supplemental request had kind of within a time frame. Was it by 2029?
We put 5 years, and really that was
just to give buffer.
Yes.
All right.
I sincerely hope that it's not 5 years, but that was to give us a buffer if there's something that's unknown to me at the moment or in the future that would come up that would impact that timeline.
This question is actually for staff. It kind of just cues up for me since there is a uniqueness to this request with the idea that it be a contingent pledge. Can you just talk to the commission a little bit about if that timeline were to be 2 years, 3 years, we're talking about a 5-year window for Bert Nash to be able to complete their portion of fundraising, the 10.5 million, which would trigger a release of the 1.5 if this commission were to approve that request. Just what should we know about what that means for staff in terms of setting aside those dollars for such a period of time? Because we frequently are re-estimating those and putting them back into general fund or elsewhere in the next year if we don't use them.
These are all in the behavioral health fund, so some of those issues don't really apply. And we've used the behavioral health fund for one-time projects before, so I don't anticipate it being an issue. We'll just keep track that we've made this encumbrance in essence, and hold on to it until they're able to produce the rest of the funding.
Okay, just wanted to make sure there wasn't
Yeah,
anything too complicated about the squishy and possibly extended timeline versus the re-estimation that is done on an annual basis.
Behavioral health fund makes it a lot easier.
Okay, that's helpful. Thanks. Other questions for Bert Nash, commissioners? Okay, well, I think that covers talking about all the supplemental requests we have in front of us. We have a few other partners here with us, which thank you for being here. Any questions for our partners that are at the table otherwise?
My question may be for staff, and I think it goes back to the earlier conversation about SUD. So when I look at the packet, I see Mirror was at 294 and some change last year, and the request this year is for 200. And when I look at H-RADAC, Heartland RADAC, sorry, Jason, I'll give you a new name there. It was at 817, and then this year is that because it's in the SUD fund? Is that's the way you're thinking about it?
That's part of it.
Okay.
In the case of Heartland RADAC was providing services in the jail, and we put those services together in one contract. And so that's the explanation for the difference. Mirror is now providing services in the jail. Heartland RADAC is not in that work. And again, what I would say about the 200,000 is that was a good basic starting point through which mid-year we could evaluate how much is being spent. Are there places like, for example, last year, the MAT allocation was significantly being underutilized after the first 2 quarters. So we made an adjustment, which we brought back to the commission to redirect those dollars to SUD, residential treatment and intensive outpatient services.
Okay.
So the intent there is to have flexibility as the year goes on and the year progresses, so that if we need to make adjustments, we're able to make those adjustments because we haven't promised one agency a fixed allocation that they may or may not utilize based on whether their service is online, whether their service is staffed to the degree it has been, budgeted and anticipated to be staffed.
Yeah, I just would and then DECA's is the same number across there, and I know they're in that space as well. So, I think I understand it. It's a matter of translating it for the public and for commissioners to make it easy to understand. If it's a pot of money that we're using, can we also see it in that line of that community partner as well? Is that making sense, Bob?
Yeah, and I think service agreement's probably the best place to see that. And
Yeah.
so, we could highlight that information if you want differently. But I do think we tried to really break it out here on this spreadsheet by showing what's in each pool amount. And then if you look at the reestimate, it's broken down by agency
Okay.
for now, assuming, but that can change. If the agency is not using their allocation, we want to make sure these funds get out to the community as effectively as possible.
Okay.
But we totally understand that it can be confusing.
Yeah.
But it's
I think
our
I get it.
attempt to try to get the money out there.
Yeah. And then this isn't really a question, but I want to say this for community partners so that you hear it from a commissioner. when we ask you for your budgets and we're asking for things like grants and contributions and where those dollars come from, my first stop is to staff saying, why aren't they filling these in? And they say, we try. So I'm telling you as a commissioner, I'm always looking for braided funding there. And we really got to see it. Some of you do an excellent job with it, really showing, these are the dollars that we get from this group. You detail it in your narrative. But I want you to hear it from a commissioner that it's really hard to make that connection if everything under grants and contributions is left blank. And then in your narrative, you may reference it down below. We also access block grants or things like that. So I'm just saying that we really need that completed. I know for some of, and I think Commissioner Willie was going there earlier saying, if you're very large and you cover a large area, it's hard to figure out like what is specifically Douglas County. I get that. If we could continue to work with commissioners and staff on a way to communicate that, because what we're trying to do is show that braided funding source. And when I see zeros there, it just doesn't look like that. So that's just more of a comment than a question.
I would totally echo that. I need the picture. I read all the narratives, but the stories and the numbers, and if it's not there, I really struggle to figure out, why are you asking us or why aren't you asking other places? I need to see all of that. I want to shout out Heartland Radak does this really well. So that was kind of great to see. I know. That big organization serves a lot of area, but also like here's the portion of it that Douglas County is, so we can see like we're a very small piece of what you do overall. But I like knowing that there's kind of that whole structure behind what we're paying for here.
But I guess one of the questions that I do have for RADAC is Douglas County. We are upwards. Let's see here. Sorry, Shawnee County. It looks like Shawnee County is around 184,000. Okay. So in Douglas County, 739,000. Johnson County, 243,000. So I'm just kind of curious with the other counties, what population or what percentage of the population are you serving in some of those other counties? And I guess the main question is, why is Douglas County's percentage so much higher than some of the other counties?
Yeah, absolutely. So really the biggest difference is the funding that we receive here in Douglas County is to serve the entire population. If you are in high need, we want to be there for you regardless of your status. When we go to Shawnee County, for example, it is county funding, but it is very specifically for the criminal justice population. So we are housed in the community corrections office there. We have 2 care coordinators that serve just that population, so they can't step outside and see somebody at the hospital. Those are other state dollars that we use to do that. In Johnson County, those are liquor tax dollars that we use to fund services for. They are very high need, but they're also fairly precariously housed is the primary population there. So they're just little pockets of money in those particular counties. And like I said, in Johnson County, those are dedicated liquor tax dollars that are coming in. They're not from the county's general fund or from a behavioral health fund or anything like that. And then in Shawnee County, it's very targeted to the criminal justice population.
So then do you have other funding sources or funding pools that could be displayed on this particular budget sheet? Or is this everything that's coming from other counties for the populations that you serve?
Well, what we utilize here, we do have a number of different funding sources that provide services to Douglas County residents. And that's what we try to highlight when we push out that we are braiding in a $400 and some odd thousand of work here. Part of that is some of our state dollars that we get to serve the very high risk population throughout the entire state of Kansas. We use some of our Medicaid contracted specific dollars to assist with those services here. We have a contract with KDADS to serve the multiple DUI population here. And then our block grant funds that pay for assessments and any kind of video treatment that we may end up doing with some folks.
Okay, thank you. And I believe we heard most recently in a couple of work sessions that a percentage of the population that we are serving here in Douglas County is coming from Shawnee County, is coming from Johnson County. So it's coming from some of our other counties.
Those other dollars help us fund.
Yes.
We don't want to turn somebody away because they're from Shawnee County. And so we have dollars from other resources that allow us to step in.
Okay,
those
well, I
funds.
appreciate that, but I believe also what I heard is that our Douglas County dollars are paying for some of those services. So if that's not the case, I'd be interested in understanding that, because I believe that's what some of what we are funding is doing some of that work. So if just your funding is simply being parsed out to only fund those populations for the work that you're doing for Douglas County, I'd also be interested in understanding that.
Okay.
So if the funding that you're receiving from Douglas County is strictly only for Douglas County residents, and you're only invoicing for Douglas County residents, that I'd also be interested in
Yeah,
understanding that as
It is
well.
one of those questions, and it's a good question. And it's one of those things where how do you part and parcel some of that out when somebody is homeless and they show up here? Where are they really a resident from? Our hope is to get them back to where they consider their home to be. Some folks are coming down here and there's, this is where my home is going to be. So I think maybe I can look into that a little bit to see if I can't detail that out a little bit more for you specifically, because that's one of those mucky questions that how do you decide when you're using these funds versus those funds, even though they're both actually supplementing all of the work.
Yeah, thank you. Because I'd be interested in
Yeah, we'll look into
how
that.
you do that,
Yeah.
especially if you're already doing that for Shawnee and Johnson County with those particular funds.
Sure.
Okay, thank you. And Lori, I think you were about to say something as I asked that question. Okay,
You can
Sorry.
answer my
All right.
questions if you'd like. That would be fine.
All I was going to say is I appreciate the question about braided funding. And when we do things in March and present, and then we have nearly 3 months before we get to this point, and then we have another 6 months before we get to the money starting, it does create a challenge. We'll do our best, but things change almost daily in this funding area, which I think you appreciate because we are looking for other funding.
Other questions, commissioners? Okay. Well, I believe that brings us, well, it certainly brings us to the end of our time with our behavioral health partners for now. Thank you all for being here. And do we have anything else on the agenda stuff? I think that's.
No, just want to remind folks that might be listening online. We started tomorrow morning at 9 a.m. with the sheriff's office, and then we move on to our justice partners, and then we'll end up with our heritage and land partners tomorrow.
Thank you, Sarah. Okay, with nothing else for today, we are adjourned until 9 a.m. tomorrow. Have a good day, everybody.